Good afternoon, everyone. Welcome to the SRAE TTA virtual topical training. My name is Megan Yarber from Public Strategies, and I'll be the host for today's session. Before we get started, I'd like to review a couple of housekeeping items with you and explain how you can participate in today's Zoom session. We invite you to use the chat box to ask a question, make a comment, or to address any technical issues you may be having. Please be sure to select from the drop-down menu to everyone so that the moderators and presenters can read your questions. If you do not see the chat box located in the panels on your screen, please select the chat icon in the bottom of your Zoom window. The controls will auto-hide, so you may have to mouse over to the bottom of your screen to display your meeting control toolbar. Polling features will be used throughout the topical training. Participants will be prompted to answer polls. If you don't see the poll, you will need to enable pop-ups in your application settings or change your Zoom video layout. Zoom video layouts are located in the top right-hand corner of your screen. These presentations will be recorded. Recordings, presentations, and handouts will be available on the SRAE Exchange after the topical training has concluded. At this time, I would like to introduce our first presenter today, Kendy Cox, Vice President with Public Strategies.
Hello, everybody, and thank you, Megan. As she said, my name is Kendy Cox, and I bring you greetings from Oklahoma City, Oklahoma. I'm here today representing Public Strategies, which, for those of you who don't know, Public Strategies is the firm that has a contract with FYSB to provide training and technical assistance services to SRAE grantees, aka each of you. So if you haven't already, through this training, you will get the opportunity to meet many of our TTA team members, as well as continue developing your relationship with FYSB staff. And I want to assure you that all of those team members are excited to interact with each of you this week. So please, even though we are virtual for this training, please don't hesitate to engage those team members as you can during the training or reach out at a later date. We are all here to interact with you and serve you in the best way that we can. So before we jump into our training content today, I want to briefly address a few aspects of this training. First, if you aren't watching the participant numbers go up and up and up on the Zoom, we have a big group this week. So one benefit of transitioning to a virtual format is that we don't have the traditional space constraints. So we've had a lot of people that wanted to attend this training. We've been able to give them that opportunity. We have more than 300 registrants for this particular training. So I first wanted to commend each of you for prioritizing this important training content. Now, on the flip side, as you all know, virtual also poses some additional challenges. So I'll ask for your patience through the next couple of days, but I'll also ask for each one of you to really commit to your engagement in these training sessions. I know many of you may be at home, you may be balancing multiple responsibilities. So we're going to do our best to keep your attention and provide information as well as resources to continue receiving the benefits of what is presented this week. Second, I wanted to mention that this is a track-based training, meaning we have developed content that is tailored very specifically to the needs and roles of both program managers and facilitators. We know your time is at a premium, and we want to spend that time gaining information and skills that you can immediately use to do your job better in whatever role that you're in. So if you look at the agenda, I trust that you'll see the sessions that are designed specifically to, one, help facilitators learn best practices and skills to become an effective deliverer of SRAE content. Likewise, you'll see content that is designed specifically for program leaders to ensure high-quality program implementation in areas of legislative alignment, grant oversight, and best practices for program excellence. And then, in addition to that track-based content, there are sessions that we've determined are really best delivered to everyone because they cover foundational SRAE principles that are important no matter your individual role. But we believe that at the end of our time together, we are confident that you will have more tools for your toolboxes and will feel even more empowered and motivated to serve our country's youth. So welcome. Now it is my honor to introduce to you Elizabeth Darling, who is the Commissioner at the Administration on Children, Youth, and Families at the Administration for Children and Families at the U.S. Department of Health and Human Services. In addition, she also serves as the Acting Associate Commissioner at the Family and Youth Services Bureau within ACYF. Previously, Darling was the Chief Operating Officer of the Corporation for National and Community Service within the federal government, and most recently was the President and Chief Executive Officer of One Star Foundation, strengthening the nonprofit sector in the great state of Texas. Prior to those responsibilities, she served as Deputy Secretary at the Maryland Department of Human Resources, where she had oversight of child care, child support, child welfare, domestic violence, and family assistance programs, in addition to overseeing the state's temporary assistance to needy families, food stamp, and Medicaid programs. Darling's current position as ACYF Commissioner represents her second appointment at HHS. During the Bush administration, she was the founding director of HHS's Center for Faith-Based and Community Initiatives. Such an impressive resume. Commissioner, will you share some opening remarks with our group today?
I would love to. Thank you. I'm sorry, I should have sent you a brief bio. Thank you all so much for being with us today. And this far into the COVID pandemic, I think we're getting really good at the wonders of technology that keeps us connected and continues providing technical assistance and encouragement to all of our grantees across the country. We are all aware, as you are, that not only we, but our youth have been seriously impacted by the pandemic, which has isolated all of us, but particularly young people, from the social interactions that they so desperately need as they grow, contact with their peers, extended family, and friends. So I'm encouraged to see so many of you on the call today. And you come from everywhere across the United States and our U.S. territories attending this training. Thank you to Public Strategies for your work in getting us to this point here today. There are hundreds of that are continuing to show how amazing you are, you're flexible, you're innovative, and your adaptability, if you will, to the current situation. So thank you for that. I think you're going to really enjoy the next few days, what you're going to learn. And so please pay close attention, ask good questions, and jump right in and learn from your peers. At the Family and Youth Services Bureau, our vision is that all of our country's youth, individuals, families, no matter the challenges that they face, can live healthy and productive lives. And SRAE grant programs are part of that vision. A key component of our efforts are the 3 SRAE funding streams: GD, General Departmental SRAE, Title V State SRAE, and Title V Competitive SRAE. The primary focus of these programs is to teach youth how to voluntarily refrain from non-marital sexual activity. In other words, wait until you're married to have sex, and to look at other risky behaviors and refrain from those so that you can really experience optimal health. And SRAE is intended to empower youth to make those decisions healthy behavior choices that will lead them to a successful and healthy future. Youth, we hope, will be empowered by your programming to make positive decisions as they learn about and practice the skills that they need to prevent involvement in risky behaviors. At FYSB, we're proud to support you and your organizations in implementing these optimal health messages across the country. And at FYSB, we love the success sequence. Simple enough to graduate from high school, get a full-time job, and wait until marriage until you have children. And it's the best poverty prevention model there is. To that end, we're happy to see you all participate in our virtual topical training, which presents separate tracks on facilitating SRAE with excellence and SRAE program management. Our goal for this event is to provide you practical and relevant training to help maximize your effectiveness and improve your grant performance. So just very quickly, aspirational ideas, if you will, not ideas, but ideals with an L, to normalize sexual delay as a number of benefits to youth. Through the We Think Twice campaign, and if you haven't checked it out, please do. It is an amazing, amazing website built with youth for youth. We've learned about real testimonials of youth who choose their present and their future goals over participating in risky behaviors. All youth deserve the information and skills that give them the best opportunity for the best health outcomes, moving youth away from those high-risk behaviors to low risk or no risk, and avoiding things that can upset their trajectory of their life. No matter where a young person is regarding sexual activity, they can be empowered to make new choices, to move away from sexual activity by self-regulating. You're going to be helping them set goals and do some healthy decision-making. The optimal health model provides opportunities for all youth to achieve a risk-free status that supports their flourishing and well-being. It's more about just preventing pregnancy and disease, although that is paramount. It's about helping youth build those healthy relationships, about impact for good, now and for their future, recognizing the whole person and the importance of balance and the importance of engaging their parents in the process. You are change agents, and thank you so much for the work that you do and will be doing in the future. Thank you, Public Strategies, for what you're going to be teaching us, and I am certain this training will provide a worthwhile experience for all of you as you work on your projects and as you influence positively the youth within your sphere. Thanks, and have a great training.
Thank you, Commissioner Darling, and thank you to Kendy for those opening remarks. And now I will introduce our first moderator for today's first session, Marianne Mozak, President and CEO of Ascend.
Hello, everyone, and we're really so pleased that we can all be together, not really seeing each other, but actually seeing each other, so it's all good. So we're going to start with our first joint session. And the title of this session is Understanding Predictors of Behavior Change. The presenters for this particular session, which is both tracks joined, will be Jerry Regier, who is the Director of Adolescent Pregnancy Prevention Services for Public Strategies, and Tammy Bryant, Chief Programming Officer for Heritage Community Services. You can see more extensive bios for the presenters on the registration site. And we want to encourage you that during this session, there will be questions, there will be polls, and we want everyone to join in, give us your opinion. And then also remember that after the end of each day, there's going to be a feedback form for you to express what you thought of the different sessions. So just keep that in mind too. So without further ado, I would like to hand this over now to Jerry Regier.
Thank you, Mary Ann, and good afternoon to everyone. We have looked forward to this training, and now it is upon us, and we're excited about sharing with you. This session will provide some foundational concepts from the research that will be helpful, I think, to you as administrators and facilitators as you deliver the SRAE education. In the first part of the presentation, I'm going to discuss predictors of behavior change and how these predictors relate to SRAE. And in the second part, I'll introduce Tammy Bryant and two of the peer educators who will lead in a practical engagement with what I'll be talking about initially. So I just want to encourage you that this first part gets into some of the theoretical foundations. So hang with me, because I think it's going to provide a great foundation for you. And then as the peer educators come on for the second half, they will be able to take that information and engage you. The learning objectives for this session are understanding the theory of planned behavior, and understand mediating variables that predict delayed sexual initiation. You know, mediating variables, that's kind of a research term. They explain the relationship between two variables, usually the independent variable and the dependent variable. The independent being the predictor, the dependent one being the outcome. And so I'll tell you more about that as we go through. And then I want to identify relevant behavior predictors for SRAE application. And then the second part will be understanding how peer educators can implement some of these ideas. The goal of SRAE is not to just impart knowledge. The goal of the SRAE program is to influence behavior change, and to do so by leading adolescents and youth toward voluntarily choosing optimal health behaviors for their personal well-being and future success. This next diagram is taken from the Bloom taxonomy, which some of you may be familiar with. The Bloom taxonomy categorizing learning into three levels: cognitive, the emotional, and the behavior. And the learning, of course, begins with the cognitive, moves to the emotional, and ends with the behavioral. And so you can see here we have the emotional, which is the attitude, belief, and values. And the cognitive, which is the awareness, knowledge, and understanding. And then the second one is the emotional, which is the attitude, belief, and values. And the third one is behavioral, the efficacy skills, the commitment, practice, and reinforcement. And so the overall goal for the SRAE program is, and for the program administrator and the facilitator, is to impact participants at a deep level of intervention. And I know that's exactly what all of you intend to do. Understanding and internalizing the mediating variables that we'll be sharing that predict delayed sexual initiation, program administrator and facilitators can realize this goal, we believe, of really impacting behavior change in the youth that they serve. So today I'm going to go through 3 different questions and to kind of understand the foundational ideas. And the first is, what is the research underlying behavior predictors? Behavior predictors are based on social learning theory. And one of the pioneers was Bandura, whose social learning theory emerged during the 60s and the 70s, emphasizing the reciprocal interaction between cognitive behavior and environmental determinants of human behavior. So in other words, it's kind of like being taught something and then watching others in a social situation, then absorbing that and imitating that behavior, and then practicing that behavior and making it our own. So emanating out of this social learning theory are a number of other theories that have influenced behavior predictors, including the one we're going to look at today, which is the theory of planned behavior. The theory of planned behavior came from Eitzen and has been widely used for the prediction and modification of human actions. It recognizes and applies certain constructs to the particular behavior of interest and is focused on predicting, understanding, and changing human social behavior. The theory states that intention is the precursor and main determinant of behavior and is influenced by attitudes towards the behavior, by subjective norms with respect to the behavior, in other words, social pressure, and the perceived control over the behavior, self-efficacy. How much do I, as the person in the situation, how much do I believe that I can control that situation? And so I'm going to have 4 slides here on the theory of planned behavior, just to kind of give you an idea of how it operates. And I hope this is very helpful to you to understand what the theory of planned behavior really is. The first one is, this is the core of the theory, and it takes the 3 areas that I already talked about, the attitude and the social pressure and the self-efficacy, and basically those go towards the intention, which lead toward the behavior. And I'm sure you can see immediately that this is exactly how individuals operate. It's our attitude, what we think about what other people are thinking, and how much control we think we might have over that behavior. And then we form some intention of how we're going to act as a result of that. And the next one is the direct compatibility. It aligns the direct measures and the intention so that you can really see exactly what you're interested in and then test that. What Eitzen went ahead and did was he talked about beliefs. He called them simply beliefs. I'm calling them underlying beliefs. And so you can see that behind each of the direct measures is an underlying belief. Behind attitude is behavioral beliefs. Behind social pressure is normative beliefs. And part of what that is saying is that, you know, the young people that we serve, many of them believe everyone is having sexual activity, and they think it's the norm. Maybe that's not true. And so what we need to do is get to those underlying beliefs in what we are sharing with them. And then under self-efficacy, the underlying belief is, can I control what I want to do? Or do I have to go along with the pressure that's around me? So these are the factors to focus on as we think about how this applies to our work as facilitators and program administrators. This is in some ways, the hidden part of what's going on in that young person's mind that we need to be focused on. Behavior predictors are related to psychosocial cognitive constructs, and out of these theories have come common constructs like behavioral intention, self-efficacy, outcome expectancies, attitudes, and social norms. And these have been shown by researchers to be significantly related to adolescent sexual behavior. There have been a number of studies that have taken place, and I'm not going to take the time to go into them, but you can see these slides later and look up some of these studies. But these studies have established significant links from the program to the mediators and from the mediators to the outcomes. And so you can see from this chart that the program inputs, and those are the things that all of us are very familiar with, because that's the part we see. The content, the focus, the emphasis, the process, the teaching, the teacher themselves, the facilitator, the dosage, how many times we have the class, and all of that comes together to come into the program impact. All of that works together to impact that young person. And it's that impact that then leads to the outcome. And it's that middle section where we're trying to concentrate by looking at what those factors are that really are going to impact that young person. Research predictors in the literature examine the empirical linkage between the program and the mediators and adolescent sexual behavior. And they can help identify how the young person is going to respond. And they can contribute to the goal of developing programs that effectively change behavior. So the second question, how are these predictors relevant to the SRAE program? Based on the research and the premise that key factors are operating in an adolescent's life, we know this. We know that they have a direct and strong impact on their risk behavior. We know that they are amenable to intervention and influence. The research tells us that. And we know that they can be specifically targeted by the intervention, and they can be reliably measured. And so the relevance, the key questions that come to mind then are, what are these factors that are operating in the adolescent's life? And what are the mediating variables that predict sexual initiation and sexual delay? And how are students affected by the intervention? So let's look at what the predictors are, and then you're going to take these and begin to see, to do some practice with our next group of presenters. So these behavior predictor constructs are for SRAE, and you can see them on the screen. And the predictors are rationalization, self-efficacy, outcome expectancies, attitudes, values, conviction, pre-behavior decision, which is really the most influential. And what Dr. Weed and some other researchers have done is they've taken those and they've given them terms that relate to SRAE. So rationalization is called justification for sex. Self-efficacy is called abstinence efficacy. Outcome expectancies is called future impact of sex. Attitudes values called abstinence values. Conviction called independence from peer influence. And peer behavior decision called behavioral intention. Each of these has a terminology that if you become familiar with, you will then begin to notice how it operates in the youth in your classes. Justification for sex is the agreement with the rationalization and justifying that students often engage in to legitimize their initiation into sexual activity. Abstinence efficacy, the confidence and ability to engage in refusal skills and avoid situations that could lead to sex. Future impact of sex, perception that sex could interfere with goals regarding education, careers, marriage, and family life. And abstinence values, importance of refraining from sexual activity outside of marriage and its inclusion in their moral value system. Independence from peer influence, the ability to follow your own system, value system, and personal goals, and ability to communicate standards and values. And behavioral intentions, the level of intent and commitment to refrain from non-marital sexual activity. So with those in mind, what I want to do now is introduce Tammy Bryant. And Tammy Bryant is a peer educator, facilitator, trainer who will lead this section. She is the director of programs for Heritage Keepers, and she will introduce the two peer educators that are going to go through this with her. Tammy?
Thanks so much, Jerry. So now that Jerry has explained the research behind these identified mediating variables that impact behavior, my hope for the rest of this presentation is that you will see how to take this research and practically apply it to your implementation so that you are effectively impacting behavior, because that's what we all ultimately want, right? We want to all make an effective behavioral impact in teens' lives. So if you only have limited time with teens to make a difference in their life, wouldn't it make the most sense to take this research and figure out how to translate it to practical application? So I'll be speaking for most of the rest of this presentation, but I've also asked Latika and Leah to demonstrate some of the examples. Latika is the lead educator and one of the national trainers for the Heritage Keepers curriculum, and she has been documented by third-party evaluators as highly effective in affecting teens' behavior to abstain. Again, that's really ultimately the goal. We want them to abstain. So she was trained in these predictors more than a decade ago, and she has been using this approach with teens ever since. And then Leah is the executive director of Intersections Incorporated in American Samoa. And she was trained in these predictors about 7 years ago. And she has been effectively implementing them with youth and also monitoring the evaluation and feedback of her staff's impact on them and integrating them throughout her organization's operations. So the following process that I plan to discuss is how Heritage Keepers has integrated the behavior predictors into our SRAE curriculum, program, and model, and then show you how you can do it too. So I'll first share the process with you and then spend a few minutes on each step. Then we will also give you a chance to experiment with it. So here's the process. All right, so here is the process. The first part is study the key predictors and how they present themselves at each level of intervention. Second, then match the predictors to each content section of your curriculum. And then create and write a discussion question or statement that intentionally targets the predictors relative to the content section of your curriculum. And then implement with your students. And then the fifth one is use your observation to gauge responses from students relevant to the predictors. And then the last part is then you just need to determine some follow-up statements or questions that will move the students to a deeper level of intervention on that predictor, which will then impact behavior. So essentially, if you know the constructs that can predict and influence behavior and your end goal is to have an effect on behavior, that mindset is what guides what you focus on. We aren't just normalizing the optimal health message, but having them actually choose optimal health for themselves. So I now want to go through each step of the process in further detail. We'll go on to step 1 in the next slide. So the first thing to do is study the key predictors and how they present themselves at each level of intervention. So what do I mean by that? I literally mean study the predictors and the levels of intervention that Jerry covered. So know the definitions of these predictors, and I like to say know them forwards and backwards. I actually have our staff put them on flashcards, study the definitions and name the predictor, and then also do it the other way around of studying the predictor names and then trying to give their definitions. And by doing that, you end up embedding them in your mind so that they are always in the background as you teach. Make them actually part of your DNA so that you can easily hear them and pick up on them really when anyone is talking, not just youth, but anybody that you're talking to, you'll start to hear them. So for example, when you know them so well, you really will hear it from each person you speak to. When I try to get my own children to take on new tasks and I hear them say, "Mom, I can't do that," I realize that they have low self-efficacy in whatever skill I was asking them to do. And what they need from me is to find ways to build their self-efficacy by teaching them how to do the skill. I need to build their confidence and show them that they can do whatever it is I'm asking them to do. Or when I'm talking to adults in the community who believe that teens can't abstain, what I hear is that the adults in their teen lives have a low abstinence efficacy for those teens. So my ears are always listening for these predictors. On the next 2 slides, Latika is going to demonstrate for you what the predictor future impacts of sex sounds like on all those different levels of intervention. So integrating the predictors with the levels of intervention. So not only are you listening for certain predictors when teens speak, but you are listening to what level of intervention they are speaking from. So if you could go to the next slide and Latika will cover that.
Great, thank you, Tammy. So as you can see, there are multiple levels of intervention that need to be addressed in order to influence behavior. And intentionality is the name of the game here. Now I'm going to show you an example of how future impacts of sex actually presents itself at each level of intervention. As you can see, awareness is at the surface level. When it comes to future impacts of sex, the students are able to recognize that sexual activity now can impact their future. If a student is at this level, they are able to say something like, "I heard that sexual activity now can impact my future." Knowledge, students can discuss how sexual activity now can impact their future. They can be tested in this knowledge. Students on this level may say, "I know that sexual activity now can impact my future." Then we have understanding, and at this level, the students are now able to calculate how sexual activity now could impact their future. They can explain it. And if you have moved the students all the way through to an understanding of the predictor, you have laid the foundation of knowledge for behavior change. But like G.I. Joe said, our great American hero, knowing is half the battle. I just totally aged myself. If you were to stop here, it is very likely that there will be little, if any, change at all. And like Jerry mentioned earlier, awareness, knowledge, and understanding are all on a cognitive level. Next, we begin to impact on a deeper, more emotional level. attitude. Here, students are able to demonstrate a positive attitude about avoiding sexual activity now, benefit their future. They are for abstinence and able to see that it can benefit their future. But how many of us know that feelings are fickle and subject to change? But you are definitely at a deeper level here. Next, belief is when students take a firm position. They can actually demonstrate a belief that avoiding sexual activity now could benefit their future. Next slide, please. So with value, students actually value the behavior of avoiding sexual activity as a means to benefiting their future. This is more than a belief. It has become a part of who they are, a part of their makeup. So now we have really begun to influence behavior, right? Yes, but guess what? If you stop here, the behavior of too early sexual activity may be delayed, but it is usually temporary, not sustainable. So now we're entering into sustainable behavioral levels of change. Personal efficacy is where the students are confident and have the skills to avoid sexual activity. It is a part of their life. After efficacy is commitment. So again, pertaining to the predictor of future impacts of sex, the students make a commitment, a conscious decision to their future and to avoiding sexual activity as a means of benefiting their future. Practice is when the students have avenues for demonstrating their commitment and their skills needed for protecting their future and avoiding sexual activity now. And reinforcement is when the students have people around them that support and reinforce their commitment for avoiding sexual activity now as a means to benefiting their future. Now, what I just showed you with future impacts of sex needs to be done with each predictor at each level of intervention in order to maximize the potential for behavior change and sustainability. Students who have reached the deepest levels of intervention are more likely to delay sexual initiation on a long-term basis.
All right, thank you, Latika. So the next step in the process is to match key predictors to each section of the curriculum that you are using. So these predictors, what we know from the research is that they are effective for any race, age, gender, socioeconomic status, et cetera, because they are intrinsic in every human being. And therefore, they can be applied to any curriculum. So curriculum content provides the context for addressing these motivating factors, but the facilitator must also be intentional about affecting them. So you must ensure that all predictors are utilized. You can't have a favorite predictor that you solely focus on. You must target all of them. All predictors must be effectively addressed to achieve the desired behavioral outcomes. Jerry shared that research that showed that we are all motivated by our intentions, rationalization, self-efficacy, beliefs about the future, et cetera. So you can't leave any of those predictors out if you're trying to impact teen behavior. Next slide. So then the next step in the process is to create a discussion question or statement that would intentionally target the predictors relative to the content section that you're covering. And my suggestion is that it's best to write it out. Write a sentence or two of something that you could say that could essentially connect the dots between content information and predictors. So it may be a rhetorical or thought-provoking question or statement, and not all predictors will be targeted in every lesson of the curriculum. So once you've determined which predictors you will intentionally target in each lesson, and once you've written down some discussion questions and statements, the next thing is that you're going to practice effectively delivering every question or statement in all the sections prior to implementing with the students. So essentially do some mock teaching. Get some feedback for improvement from your program managers and peers. Ask them to tell you if you connected the predictors to the content effectively, and then keep practicing until you are confident. Next slide. So now we're going to give you a chance to try to put this into practice. On the next slide, you will see a statement that may be similar to a statement that you might have in your curriculum. And I want you to look at the statement and consider what predictor or predictors, plural, could be integrated into the presentation to the students. I'm actually going to ask Latika to lead this exercise with you. So go on to the next slide.
Thanks again, Tammy. And can everybody hear me now? I got some audio. Okay,
Yes,
so
sounds great.
Great, thanks. So like Tammy said, we chose a knowledge-based statement that could be used in any SRAE curriculum. And now it is time for you to take the following factual statement and use it to influence a predictor in order to impact behavior change. Herpes can be transmitted from mother to child during a vaginal delivery. Using the predictor future impacts of sex, what discussion, questions, or statements could you use to connect this knowledge-based information to impacting the predictor? Please share your questions or statements in the chat box. And you can begin that now. So again, I just want to reiterate, using future impacts of sex, the perception that sex could interfere with the student's goals, careers, marriage, and family. How can you tie that predictor in to the statement, herpes can be transmitted from mother to child during a vaginal delivery? I'm going to give you about 40 seconds to answer. I know it takes a lot to type the questions or statements. Okay, I'm seeing some great responses coming in the chat pod. Some of you are saying, what would that look like for you to consider your future family? I saw some, how can contracting herpes affect your lives in the future? How could it impact your future children? So great. Having comments similar to, have you ever thought about how your decisions about sex could impact your future children? Connecting that to future children or future is definitely a way to use the predictor future impacts of sex to influence that factual statement. Awesome job, guys.
All right, so I also looked through those chat boxes. That was a lot of questions coming in at once. And so I saw some questions that were really more fact-based questions. It was saying, you know, asking the student how could herpes be transmitted, or what are some ways you could prevent herpes? And that's still knowledge and cognitive and just fact-based. It's not necessarily connecting it to the predictor. But for those of you who put questions in there that connected it to the predictor, that's what we're going for. Is you might have this fact in your curriculum, but then you just connect the dots and say something like, have you ever thought about how your decisions right now about sex could affect your future children? So you're getting them to not just receive a fact, but you're connecting it to a predictor so that it can impact their behavior. All right, so great job. Let's go on to the next slide. So this one is real simple. Really, the next step is to simply implement the content of your curriculum with the integrated predictors. So when you implement, you have to be intentional so that every sentence that you say, your words, your questions, your phrases, that they are all targeting the predictors. Next slide. So the next part of the process is to use your observations to then gauge responses from students relevant or relative to the predictors. So you should be just actively listening for predictors every time a student speaks. Carefully observe their responses, their body language. During the discussions, use your observations to gauge where that student is in choosing to avoid sexual risk. So essentially listening to where they may fall on the level of intervention for that predictor. So your internal gauge should be maybe a Likert scale of 1 to 5, with 5 being the desirable outcome. And I know this might sound a little cheesy, but what I like to do is I actually like to picture a Likert scale really above each person's head every time they speak. And I'm always gauging where they would score on that scale based on the words that the students say or what they ask. So next slide. So let's again do a little practice applying what you just learned. On the next slide, you're going to see a statement that a student may make out loud in your class. And I want you to first determine what predictor you hear. And then after that, you'll have a chance to determine where you think that statement would fall on a Likert scale. So let's go to the next slide. So assuming that somebody in your class makes a statement like this: "You've convinced me of the benefits of avoiding sexual risk, but I'm just not sure that I can actually abstain from sex." So I'm going to ask that the poll start, and I'd like you to choose what predictor you think you are hearing in this statement. So the definitions of all the predictors are there on the screen to refresh your memory. And if the poll pops up covering your screen, you can simply click on the top part of it and drag it over so that you can see the definitions. And I'll give you a few seconds to answer the poll. So the question is, if your student makes a statement that "you've convinced me of the benefits of avoiding sexual risk, but I'm just not sure that I can actually abstain," what predictor are you hearing in that?
We will allow an additional 15 seconds for you to submit your answers, and then we'll publish the polling results. All right, so I see the polling results there that 45% of you chose abstinence efficacy, and that is the correct predictor. So when you're trying to determine what predictors you hear for abstinence efficacy, that is when they feel like they are confident that they have that skill. So when you hear the words like "I can't do it," or "I can," or "I feel unsure of myself," that is measuring efficacy there. Okay, so we can close that polling box and move on to the next slide. So now let's take that same statement from a student, and we now know that it relates to the predictor abstinence efficacy. But now I want you to take another poll and answer where you think the student would score on a Likert scale on abstinence efficacy. So again, the statement is, "You've convinced me of the benefits of avoiding sexual risk, but I'm just not sure that I can actually abstain." Do you think students would score a 1 to 2, meaning they strongly disagree that they have abstinence efficacy, or a 3, meaning they kind of agree and kind of disagree that they have abstinence efficacy, or a 4 to 5, meaning that they strongly agree that they have? And again, if you need to move the poll out of the way so you can see the slide, simply click on it and drag it over, and I'll give you a few seconds to answer. All right, so we see the polling results here that the majority of you chose number 3. So I actually chose that I felt like this sounded like they really didn't think that they could abstain. Like when they start saying that "I just don't know that I can actually abstain," like they really have a lot of self-doubt. But I understand how some of you would have chosen a 3. In my mind, what a 3 would sound like would be something like, "I plan to abstain, but I don't know what to say if I'm pressured." So that's somebody who's already kind of in the middle of they want to abstain, they just don't know what to do or not. And just so you would know, a 4 to 5 might sound something like, "I believe in the benefits of avoiding sexual risks, and I feel confident that I can tell the person that I'm dating." And I know that that doesn't sound like actual teens, but maybe more realistically, a 1 to 3 might sound more like, "I just don't know that I could tell the person I'm dating that I want to abstain." Or they might say something like, "I feel too embarrassed or not confident to state my boundaries to others."
So in this example here, I think it's great that the student has been at least convinced of the idea of abstaining, but just having that knowledge of the benefits does not mean that there is a behavior impact yet, which remember, that behavior impact is the goal of SRAE programs. So the student needs to be given the skills at this point, and they need to be given the confidence to actually abstain, which leads us to the last step of the process. So let's move on to the next slide. So now that you have gauged where your students are on the predictor, you can't just leave them there. So you need to determine some follow-up statements or questions that will move the students to a deeper level of intervention on that predictor. So you will guide the discussion towards improvement specifically on the focused predictor. And note also that there will be various levels in every class. So flexibility is important, but remember that the end goal is to try to have every person in the class move closer to a 4 to 5 on each predictor by the end of the curriculum, which once they're there on a 4 to 5, it means that they would actually be more likely to abstain. Next slide. So here's another chance for you to practice what you've just learned. I'm going to ask Leah to lead this exercise and then also ask how she integrates the predictors into her organization's complete program model. So in this exercise, we are going to refer back to that previous statement, which again, it was, you've convinced me of the benefits of avoiding sexual risks, but I'm just not sure that I can actually abstain. So we've already determined that it would score somewhere maybe between a 1 and a 2 or 1 and a 3 on a Likert scale. So now I want you to determine what follow-up statements, questions, or activities could you do to strengthen that predictor towards a 4 to 5. And you can go on to the next slide. So this is the chance for everybody to enter information into the chat box. And if Leah could be monitoring that, and I can also be watching as well.
Sure. Good morning, good afternoon to all of from American Samoa. I'm going to give you a couple of seconds to respond to that statement. Very good role playing and allowing them to practice refusal skills. So what we want to do is we want to build the student's confidence and we want to strengthen that predictor. And I may say something like to the student like, hey, I believe in you and you've demonstrated your ability to make healthy choices by being here. So I feel confident that you also have the grit and determination to commit to this too. Or I may also say to the student, thank you for being so honest. And I know that sometimes it can feel so overwhelming to learn a new skill set. And this program is going to give you a chance to learn and practice refusal skills so that you can feel more confident and equipped to be abstinent when we are done with the class. And one of the activities that we use to build their confidence is role-playing or create mock scenarios where students can practice stating their boundaries and also to stand up against the pressures to have sex. And so, but when you think about it, you know, it's why schools practice fire drills, so that when an actual fire happens, the students will know exactly what to do and where to go. Next slide. This is a very important process because you want to hire the right people who believe in the message of abstinence, because they'll either make or break your program. You know, and kids, they can see right through whether you're an educator, mean what they say, or they're just there for the paycheck. And some of the questions you could ask in the interview process when you're hiring facilitators may include something like, do you believe that teens can abstain from sex outside of marriage? Or if a teen is sexually active, how would you change his or her behavior to abstain from sexual activities? And what I will be doing as an administrator is I will be listening for answers that will affirm the teen's self-worth or affirm their values or the future impact of sex. And so for training and facilitation, we require 4 days of training certification. So to make sure that facilitators are able to understand and that they're able to integrate these predictors in their daily lessons, and also to be sure that these lessons are taught with fidelity and targeting these predictors. So what we do is we have pre and post surveys that are implemented before and after each cohort session. And then we send them to an outside evaluator. And through those findings, we can see which facilitator scores less on which predictor. And then we provide feedback to help the facilitator to improve in those scores. So it could be observing them while they're teaching in the classroom or having them shadow another facilitator. And the goal for us is to help them increase their scores on the Likert scale. And for us in American Samoa, we chose the Heritage Keepers program because of these predictors of behavior change. We started about 7 years ago when teen birth was high, and it was difficult to get into the classroom to teach this because topics like sex education are widely considered as taboo topics in the Pacific Island communities. But what we did was we had a private school that took a chance on us, and they noticed changes in their students' behaviors, and we used those scores on predictors to open the door for discussion, and where we are now implementing on school campuses. And so last month, with the whole taboo topic, we met with the Council of Chiefs, and we helped them to understand these predictors so that they can help us to advocate for sex education among teens, and also to increase awareness for parents and to increase the efficacy for adults who believe in the fact that teen can actually abstain from sexual activities. And last month, the Paramount Chief endorsed the program, and he's now working with chiefs in other districts to implement SRAE and breaking that taboo that's been there for generations, just simply by understanding these predictors. Next slide. Thank you, Tammy.
Thank you, Leah. So hopefully that presentation, that little slide right there showed you that these predictors are not just for implementing. It actually is also from an administrative level, and listening for these predictors when you are interviewing new candidates to work for you. Looking at these predictors for how you monitor and observe your educators, listening for these predictors in the surveys, providing research. We can study, we can measure these, and then also she uses that to get more buy-in from the stakeholders there in her community. So on this slide, I just want to briefly explain how we use that here at Heritage Community Services, this process. So we use highly valid and reliable questions on a survey to monitor students' levels on these key predictors before and then immediately after program implementation. We then monitor the outcomes for each of our educators, which are then shared with the educator for the purpose of ongoing improvement. So this should happen really in real time. So maybe about 2 to 4 weeks after they implement. So this isn't waiting till a year-end report to figure out how we've done. We're trying to do this as soon as possible so that they have enough time to improve on these predictors before the next implementation. And so this really acts as our continuous quality improvement plan, or you might know that as a CQI plan. So we know that if the students are scoring strong on predictors by the post survey, we know then that they have a higher likelihood of actually abstaining, which again, that is the desired goal for this funding, is that we want them to actually choose an optimal health lifestyle. And so what we have discovered is that by focusing on effectively applying scientifically derived predictors of teen sex to sexual risk avoidance programs, the probability of strong and long-lasting protective behavioral outcomes is significantly increased. So that's the end of the presentation. If you go on to the next slide, there is a chance for you to ask questions either of Jerry or me or Latika or Leah.
Just as a reminder, you can use the chat box feature to ask the presenters any questions you might have. And if you aren't seeing your chat box, please make sure that you have it selected in the panel on your screen. It's located in the bottom corner of your Zoom window.
So I see a question there about what resources would you recommend to learn more about these predictors? So I know that if you read some of the research about the predictors, I know that Dr. Weed has several articles that he has written to be able to connect these predictors to behavior. And then the research article that he actually did on the Heritage Keepers program showed he was able to show that the Heritage Keepers program caused the change in the predictors, which was the cause of the behavior. Rarely ever do you have a causation. You typically have a correlation in social science. But he has really done a lot of research on these predictors. I don't know if Jerry wants to share about any of the other research that he had read. I'm not sure of any books off the top of my head, unless you want to read. I know that I think it's Albert Bandura has a self-efficacy book that's about 600 pages long.
Yeah, there are a lot of articles that, and some are referred to in our presentation, and we could certainly come up with a resource list, maybe not of the 600-page books, but from some of the key articles that you could read that would be helpful to you. I'd be glad to do that. There's another question there. How can we measure these predictors while facilitating? What's the best approach? Tammy, you talked a little bit about that. Maybe you could expand on it.
Sure. So I think that if you were to do some mock teaching in your office with your educators, it's practicing, it's connecting the dots to what would motivate a teen to change their behavior. So, if you're only giving facts, and facts are great. We need to give them all the facts. But if we're not helping them connect the dots to how it would affect them personally, then we're falling a little bit short. And so just like that example that Latika had about making that factual statement about how herpes could be transferred during a vaginal delivery, us as adults might assume that the student would automatically connect the dots and say, well, I don't want that for my future family. But we've come to realize, we should not assume that. We need to ask a question to that youth to say, how does it make you feel, knowing that you could pass herpes on to your children? Or have you ever thought about how your decisions right now about sex could affect your future family? So it's really adding in a few statements or comments to connect the dots and get feedback from your peers about whether or not you are able to do that, and then what to do next. So have your office mates or your colleagues practice giving you some answers back as if they were students, and then think of, what would I say now to help transition? I've heard what they've said, and now you have to move them on the Likert scale closer to the 4 or 5. What would you say as a follow-up? So just getting some feedback there. And I see questions here about how to incorporate these predictors into pre and post surveys. So there are some highly valid and reliable questions that are tied to each of these predictors. And what we look for is movement between a pre and a post survey. And your evaluator would have to work with you on that. But we are looking for, this isn't necessarily a measure of the kids, even though it is. It's looking at, it's the educator's job to move the students from a lower number to a higher number on a Likert scale. And that's why we can give the feedback to the educators that if they didn't get the movement that we would want, we give them an improvement plan of how could they improve. Let's observe some other educators that are getting these kinds of results. Let's do some reading. Let's do some training. Let's do some mock teaching in the office. And then I also see a question here about how to handle students being put off completely by an abstinence message.
I was going to make sure you answered that. And let's hear what Leah and Latika have to say about that.
Sure.
So I saw that question as well. And I can definitely tell you, when we initially start talking and students hear the initial concept of abstinence, because of what society pushes, it is initially sometimes a turnoff for the students, but as we begin to show the students that we're not just here to teach, but we actually care about them, when we begin to approach from a more holistic position, like Leah said earlier, the fact that, in our organization, every educator makes a decision to live the lifestyle that we're teaching. So they can see through that. They can see our passion. And I've seen students completely turned off. And by the end of the program, they love it. A lot of students that seem to be turned off initially, they're the most receptive by the end of the curriculum.
Yeah, I agree with Latika. That's how our approach also. If you focus in on the student's self-worth and their value, and they understand the future impact of sex. We've never had any student that has been turned away or refused to take the course. And even, with the whole idea of, we have educators right now who are single, and they live out that message because they went through the course. They've taken the Heritage Keepers program, went off to college, and came back, like what Jerry had mentioned, normalizing the behavior back then, and realizing that, I don't have to have sex in order for me to be cool. And so they make a commitment and share about the message of abstinence with their peers.
Thank you for joining us for this session. I hope it's provided you food for thought and some foundations as you go into each of the different tracks. And so we will end this session, and I think we have 15 minutes, and then the next session will take place. Megan, did you have anything to add?
I did not. Thank you to all of our presenters today, and we will see you guys in your next session. Thank you.